We're gonna go skydiving. It's a sport I got into in 2013, I think. High adrenaline, high risk sport, which I was told, and all the literature suggests that people who have PTSD or have been through traumatic events tend to engage in risky behavior. And a lot of people that don't have PTSD don't know what that is. They think it's, crying at the fireworks or being scared that you hear, a car backfire, all that. Not knowing that that's why you're showing up to work and you get into an argument. I know I was on a downward spiral. I know I was on a self-destruction path. Whether it was intentional or just engaging in riskier and riskier sports until one of them finally killed me because I just didn't care anymore. Because I had nothing to live for. Because I couldn't keep a stable life. Because of PTSD. We deployed in November of 2007. We pretty much made it through the entire deployment unscathed. Probably one of the most memorable things was we got hit by rockets right before we were leaving. And that kind of caught us by surprise. And I remember coming back and kind of being a little overwhelmed. It was different than coming back from the regular Army before we deployed. It was a little bit different. My best friend calls me, he's like, hey, I broke both my ankles skiing in Switzerland. I'm like, yeah, I'll come pick you up at the airport, man. I think he'd asked me something like, you seem off tonight, you seem quiet. And I just told him, I can't take it anymore. I don't have it in me. I think I'm just gonna kill myself. I can't make relationships work, I can't make work work, I'm broken. I'm unlovable, I'm miserable to be around, I can't keep a job, And he sat there and argued with me. And you try talk therapy and that doesn't work. You try cognitive behavioral therapy, saying what you feel immediately when you feel it. And I've been trying for 9 years, this isn't gonna work. There's no fix, there's no cure, there's no way out. And he's like, what about ecstasy? I'm like, I don't do drugs. He's like, no, but didn't they do a thing with that? And I was like, I'd read a headline somewhere. And they had studies in Boston. I was like, screw it, I'll sign up.
Today we are here to discuss our review of methamphetamine for the treatment of PTSD in adults.
Think of it this way. When you have surgery for, let's say, appendicitis, if the surgeon makes the incision to remove your appendix without any anesthetic, it hurts. So in this case, the MDMA acts as an emotional anesthetic to allow the psychotherapeutic therapy to be administered without the individual experiencing excruciating emotional pain.
You dose at the MDA in the morning, and you redose a couple hours later, and you talk for a bit, and then they're like, why don't you go inward with that? I go back, and I'm back in Iraq, and you followed your training, you did everything you were supposed to do, you nailed it. Anybody would feel scared right now. Anybody would carry this with you. You have this empathy. The other thing about the MDMA is you have all this empathy. And you're able to just feel for yourself and realize how awful these things were. And reassure yourself that, hey, you made it. You're good. You made it through the scary parts. That's normal. That's normal to get the PTSD afterwards. That's okay, you're not weak.
The first thing that happens is that a review committee comprised of experts in the field review that new drug application evidence. The review committee for the MDMA application occurred in June.
Our question, there is 1 vote for yes and 10 votes for no, and no abstentions.
After they vote on it, the FDA administration then decides to affirm or to approve a different, or to make a different decision than the review committee. They're not bound by what, but they usually take the review committee's recommendation.
There's a lot of potential to help a lot of patients. I just think that there needs to be more research done to address some of the questions and concerns that have been brought up today.
This therapy works. I know it works. I know it's effective. To this day, knocking on the door, security, loud noises, fire. Doesn't really bother me. Doesn't affect me. Doesn't change my mood. Doesn't bring me back. I don't care about it. And how lucky am I to have gone through all that? And I have a career. I have a fiance. I have my baby dog, Cider. I have a house.